Last question that I'm going to answer today, and it's kind of a big one. They asked, is estrogen good or bad? Yes. It all depends. So estrogen has, obviously, it has a purpose. It tends to be more growth related, so increasing the thickness of the uterine lining, getting ready for an egg to implant so that you can carry a pregnancy. Breast development tells you put on a little bit of fat, which if you're going to get pregnant may be advantageous. So it does lots of things that are important in a normal menstrual cycle, in fertility, in being a woman. But can it be bad? Obviously, too much of a good thing can be bad. That's a concept we're all familiar with. So estrogen can be bad in a couple of ways. First of all, just overloaded with estrogen or estrogen dominant can accentuate the effects of estrogen. You get a much thicker uterine lining, so you get heavier, chunkier, more painful, crampy periods, you get the breast tenderness. That can all be bad. And then estrogen, even if you have a decent amount of it or an appropriate amount of it, how you break it down can be more problematic than just overall volume of estrogen. You can break estrogen down into a 2-hydroxyestrogen, a 4-hydroxyestrogen, or a 16-hydroxyestrogen, and that is in kind of phase 1 of estrogen detoxification. Well, the 2-hydroxyestrogen is considered fairly protective, or at least not damaging, when it comes to things like breast cancer, uterine cancer, and ovarian cancer. The 4-hydroxyestrogen can go down and do DNA damage that directly leads to things like those cancers, especially breast cancer. And then the 16-hydroxyestrogen, I like to term it kind of a magnifier or an amplifier for estrogen's effects. We need a little bit of that. It's good for bone development and breast development. But if you get too much of it, then it can just be inflammatory, and it disrupts the system. It makes you estrogen dominant to some degree. So even if you make the right amount of estrogen, if you're not getting rid of it the right way, the estrogen metabolites can be particularly problematic. Now, if you are someone who has a history of breast cancer, and unfortunately we're seeing more and more of those people these days because it's not a problem that seems to be going away, estrogen can be a considerable issue for you. Many times that breast cancer was estrogen receptor positive. And that means that even good, clean estrogen can stimulate a response or a growth response in that cancer. So in those cases, estrogen can be particularly problematic in men with prostate cancer, or in men that are, middle-aged, overweight, can't take the weight off, starting to get prostate and libido issues. Estrogen can be a problem. So it's, yes, estrogen can be good or bad. It's all a matter of balance. Is it balanced with progesterone? Is it balanced with testosterone? Is it being excreted the appropriate way? Is it being broken down into something that's helpful? Do you have things to bind to it in the intestines so that it actually gets excreted permanently? Can you methylate it? Is catechol O-methyltransferase, or COMT, is that enzyme working properly to methylate and detoxify estrogen in a safe manner? So it's not just as simple as estrogen in and out, or the amount of estrogen, a simple blood test for estrogen, do you have enough or not? It's a complicated ecosystem of estrogen, and understanding that and monitoring that, I think, is very important if you want to answer this question individually for patients. The last couple of videos I've mentioned the Dutch test. We do a Dutch test to look at estrogen levels in patients and help them gain some clarity around their estrogen levels, their risk factors, and are their estrogen levels appropriate for their situation or not? Are they imparting any kind of increased risk? Are they managing that estrogen properly? That's all very important to understand, and many times when you go to your regular doctor and get a hormone test, they simply look at estradiol. Well, there are two other kinds of estrogen. We have estrone and estriol as well. All of them need to be taken into consideration. The balance of them needs to be taken into consideration. And then what you turn them into and how you excrete them, how much progesterone, how much testosterone you have to balance them, those are all considerations when it comes to answering a question specifically for a patient. Is my level of estrogen good or bad for me? So understand that when you get a test back that says, your estrogen is normal, and all they looked at was estradiol and nothing else, you don't know that. You don't know if that's appropriate for you. So is estrogen good or bad? Yes. Is there a way to determine what it is specifically in you? Yes. Dutch test is what we use. Other doctors may do other things, but that's what we use in our office, and that's how we gain clarity on your estrogen levels and how it relates to your health and your symptoms. All right, hope that helps you out. May have created more questions than answers with that one, but feel free to let me know and I'll do another video and clear it up. You guys have a great day.